So welcome to another podcast from West Hertfordshire Hospitals. We are celebrating the fact that we are now called West Hertfordshire Teaching Hospitals. We've changed our name to include teaching in our title to celebrate all the education, training, learning, teaching and research that go on across our hospitals every day. And this is very much what we're talking about today to try and understand why we've made this move and what it means for us going forward, with a focus on the detail of the learning and training activities in the Trust. And in this podcast, we'll hear from some of my colleagues that are involved in learning and development and medical education, so we can really understand all of those activities that are going on out there in each of our sites across the organisation that will help us uphold those education and training principles, making us a teaching hospital trust. So to talk about this today, I'm delighted to welcome Paul Mendes, who is the Head of Learning and Development in the Trust. Paul, thanks for joining us.
Hello, Ashley.
Now, let's start by just considering what a teaching hospital is, because some time ago, a teaching hospital was thought of as a big institution, a big infirmary hospital in a big major city next to a medical school. But that seems to have changed over time, hasn't it?
Yes, these days postgraduates and undergraduates of both medicine, nursing, and indeed all the healthcare professions will come to any NHS trust. And for example, beyond the clinical professions, you also have the graduate trainees from the National Graduate Management Scheme, which can be placed in any trust.
So there's lots of people around needing to train, learn, develop, and the obvious learners like our medical students and nursing students who are doing maybe their primary degree. There are lots of other people around in the trust needing to continue their own professional development. Our staff need to be updated and need to be sure that they're maintained in their mandatory training. And there's also, as you've mentioned, significant other learners that maybe aren't medical, clinical staff who are also developing themselves, furthering and working their way through their own education, learning, development journey.
Absolutely. I would say, as Head of Learning and Development, if you have a trust, as we do, with about 5,500 substantive employees, then you have about 5,500 learners.
So that's an awful lot of people to get through mandatory training and to be kept up to date. And, you know, and also there's a big turnover, isn't there, of new staff needing to be sort of onboarded and given information about how processes and procedures roll in the trust here. So there's a constant cycle of training going on at any time in the organisation.
Not counting the expected turnover of postgraduate medics as their terms rotate, there are between 500 and 800 new starters in any given year at this trust.
So one of the things we've talked about in our teaching hospital project is how we uphold those principles that allow us to become a teaching hospital. And what people may not know is that there is a document produced by the University Hospitals Association that details what an NHS trust needs to do to demonstrate their significant teaching commitment. So for us, that was to showcase all the education, learning, training, research activities that are going on in the trust. We did that through a showcase document that's available on the teaching hospital area of the website. And that allowed us to demonstrate to health ministers in the Department of Health and Social Care that we have a significant teaching commitment. We have the support of our main medical student university medical school partner, that's University College London. And having put in that application, it being received successfully, our establishment order was changed in December to formally call ourselves the West Hertfordshire Teaching Hospitals. And I guess from our conversations so far, it would seem that education, learning, training, development and research are going on day in, day out across the organisation. So while we're committing through this project to maintain and uphold those standards, it's very much about what this organisation is about.
Absolutely. So where I come in with learning and development is to provide essentially two parts of the learning experience for our staff. The first is the more obvious one, which is the mandatory training. That is everything that everybody has to do to maintain the basic safety standards. I say obvious, but obvious is not necessarily the same as simple, in that there are 5,500 staff and approximately 500 possible combinations for mandatory training requirements. In that respect, therefore, it is our role in learning and development to ensure that the right people are required to do the right things, and then to make sure that when they do it, it is properly recorded for when they've done it and how often, so that HR can take that forwards and ensure that people do that training when they are required to do it. The second part of learning and development is to provide that part of the experience at work and the learning at work that falls in between what's absolutely required and what is part of professional development for clinicians. In other words, we provide all those things that people might need that is different from their clinical skills. A lot of that is centred around leadership management development, which covers what people need to be the best that they can be and get the best that they can from their staff. People who have displayed excellent clinical skills may well wish to seek a leadership position, a position of authority, so as to make use of their excellent clinical skills in a way that is an example to others. That's fine, but just having excellent clinical skills does not give somebody the ability to lead and manage straight out of the box. And it is therefore from learning and development that they would receive their grounding in leadership and management development. In this trust, we have 5 internal programs for leadership and management development, all aimed at different levels, from the most junior supervisor to those who would be clinical or divisional directors and every level in between. But we also have the ability to commission places on national NHS leadership programs and send people towards those.
Yes, and those programs are very popular in allowing people within the organisation to grow and develop and, as you say, be the best version of themselves they can be in the role and aspire to roles that maybe they hadn't considered for themselves, yet they have had skills and training to be able to do. What about the coaching service? Because I know that's something that you've been particularly passionate about and working on.
Yes, so as of October of last year, we have launched a coaching service within the Trust. The idea being that we can provide leadership coaching, professional coaching, or careers coaching, or any combination of those 3 things, to any staff member who might need that. It is certainly already built into all of the leadership programs that I've just mentioned. So everybody who takes any leadership program will receive some coaching and also learn how to use those skills in their own leadership and management practice. But to make it wider, to give people the opportunity to use coaching as and when they need it, we are now in the process of building a cadre of trained coaches from within the Trust who can thus work on a voluntary basis to give out coaching to others. The ultimate intention of this would be that every staff member would be capable of reaching their maximum potential and be facilitated in order to do that through the coaching that is offered. We train the coaches in-house using a combination of internally written courses and courses that we have licensed from outside, but all of which carry International Coaching Federation accreditation. We are looking to expand this to be able to train also our senior coaches in-house from later this year. Our senior coaches being those who have more development and thus the ability to coach the most senior managers of the trust and other coaches. Previously, we would have sent those to external courses. We are looking to now license those courses to bring in-house from the latter part of 2022.
And there are, as well as leadership and management, some quite high-level training around roles and responsibilities, but there's also a lot of training going on in the trust for those activities that may be seen as more technical, maybe softer skills, things like that.
We have courses for both soft and hard skills for the workplace. So we have, for example, all of those things that people need just to be better at teamwork, from time management to stress management to courses in being able to communicate well and properly in a variety of situations. Beyond that, there is also the hard skills, things that people might have to do in this organisation that are unique to this organisation. For example, how our recruitment processes work, how to read a financial spreadsheet. So we have basically a course for everything that you could imagine in that respect, and we offer those as standalone or indeed to departmental order as and when people require that.
We've also been supporting workers develop themselves who may be on an apprenticeship working in the organisation, but on a specific scheme to get them to a particular qualification or particular level within a specialty area.
Yes, we have a variety of apprenticeships that are offered in the trust, ranging from non-clinical areas to for things like business administration, which creates our future ranks of administrators, coordinators, and eventually managers. In addition to that, we have apprenticeships that cover a variety of clinical areas, most commonly in this organisation. Those clinical apprenticeships are for healthcare support workers, giving people who come in with no qualification in healthcare the ability to learn while being paid to become either a healthcare assistant, a maternity support worker, or a healthcare support worker in another area, while additionally having now added an apprenticeship to take existing healthcare support workers to nurse associates, and as recently as last year, nurse associates to fully registered nurses. Generally, if there is an apprenticeship available nationally, then we can usually run it at this trust if the role that the apprenticeship would qualify as exists at this trust. Another area that is possibly quite commonly overlooked, but very common in apprenticeship usage, is our estates and facilities departments. And we have used apprenticeships to train a variety of craftspeople in the vital maintenance that people never notice as long as it's happening. But we can do apprenticeships in electrics, in plumbing, in carpentry, and so forth to assist those areas.
Well, thanks so much, Paul. It's been really great to hear about the learning, training, education activities going on in the Trust. And you mentioned there the nursing apprenticeship. So I think it's a good time to bring in Darren Chetty, who will introduce himself. to tell us all about the nursing, midwifery and allied healthcare professional education that he and his team are involved in across the organisation.
My name is Darren Chetty and I'm the Senior Nurse for Education. As a team providing education to our frontline workforce, we are thrilled to be playing a part in this incredible journey. In short, the education team supports educational programs for nursing, midwifery and AHP pre-registration learners, which includes learning forums and final placement programs. The team also provides training for practice supervisor and practice assessor, and we are also involved in various ICS projects. Our most recent one being the capacity expansion, where we had to develop a nurse coaching model to support learning in practice. We also support Band 2-4 workstream with a care certificate program and nurse apprenticeships such as nursing associate and registered nursing degree apprenticeship. Our preceptorship program covers newly qualified professional and has been a regular item on our education agenda. Recently, this workstream has won the Nursing Time Awards and has been regionally applauded for the model. The OSCE team provide training for overseas nurses, and we are also the training centre for ICS candidates. We also have a post-registration team providing skills-based programs such as intravenous administration, cannulation and venipuncture. The team consists of practice development nurses, practice education facilitators and clinical skills facilitators. During the pandemic, we have piloted a new role, the Pastoral Education Link Nurse, to provide pastoral support to all staff. And this role has been recognised at the Nursing Time Awards when we were voted as the best workplace for learning and development. Being a teaching hospital will help us build new relationships as well as reinforce existing relationships whilst we take our educational programs to the next level and potentially be the benchmark of the ICS. COVID has eliminated problems in the workforce and has accelerated changes in working practices. After so much upheaval in the past 2 years, gaining teaching hospital status provides us with a fantastic opportunity to create new learning environments and patterns to suit the learning needs of our staff. It is exciting for us to be part of a wider education group committed to delivering quality education, which will ultimately benefit our patients.
So thinking about our learners, and one of the most obvious groups in the Trust are our doctors who are in postgraduate training, and also doctors who are not in postgraduate training. And one of the roles for David Goodyear, who's the Medical Education Manager, is to oversee the education and training of all the trainee doctors in the Trust. So David, thanks for coming to talk to us about your roles here in education and training.
Good afternoon. Hi, yes. So I'm head of medical education at the moment in the Trust, and that oversees sort of 300 doctors in training posts in a mixture of acute and community settings. And we also have a group of about 50 to 60 non-training grade doctors and well over 300 consultants who all require support from our team in medical education and sort of pastoral care as well for those that are sort of struggling.
So we work together as the Director of Medical Education. We meet often and work together on supporting the education training needs for those doctors so that we are given a mandate by Health Education England to provide training for them, and HE work off the college curriculum, the Royal Colleges that oversee the specialties in medicine. And you mentioned the doctors not in training. So these are locally employed doctors that still have some education training and development needs, don't they?
That's right. We appointed a locally employed doctor's tutor here, which was a new post to the Trust, which is designed to support these doctors and offer them career advice because they may have taken time out of training, they may be thinking about what specialty to go into. So we provide them with sort of equal opportunities to train and learn in the organisation, providing them with simulation, providing them with study leave, internal courses as well for them to attend. So we're always considering how their career progression can also move along, as well as our formal training grade doctors.
So the education centre where we're sat at the moment is a hub for all this activity, and you've got a big team that oversees and administrates and coordinates significant amount of education and teaching, not just for the medical teams, but also for some of the nurses, midwifery and other healthcare professionals. And we talked earlier to Paul and about the training and development. So across the organisation, there's a significant amount of work being done to ensure that these programmes happen and that all the staff have access and opportunities to what they need in terms of their learning and development.
That's right. Yeah, so we've got a really very supportive and caring team in the Medical Education Centre here at Watford, but also we've got colleagues on other sites as well who provide support and pastoral care at the library and in the education centres. A lot of them are experienced now in terms of dealing with trainees, but also they're there to guide and signpost them to sort of external support networks that we have with our health education commissioners at Health Education England, UCL and St George's University. Sort of increasingly during these times, unfortunately, we've had more and more trainees who might be struggling, and we've had to sit down with them and our tutors just to support them through their training programs and sort of, as I say, signpost them to wellbeing services that are available, not just in the organisation, but externally for them as well. And that's probably the most rewarding for the medical education teams in terms of just sort of helping these people through that training year and seeing them out at the other end with a positive ARCP outcome.
So a significant amount of pastoral support being offered, and you mentioned the tutors there, and every specialty has a college tutor who's a doctor appointed to oversee the trainees in that department, and really important work. You also mentioned the library, and knowledge services is an area that's also important. People might not know that we're mandated to offer a library as part of our learning and education contract with the Health Education England, and you oversee the librarian and the library services as well.
That's right. We've got libraries and IT suites on all three sites of the trust. Perhaps with Watford being probably the hot site, so to speak, from that point of view. But we've got sort of demands. We offer support for not just doctors. Actually, it's anybody in the trust can approach the library and ask for articles or research information. It's a very, very active service, which we're currently staffing up. We've got 2 members of staff. We're looking at doubling that and actually adding an apprentice librarian as well. So it's very exciting times for the library and knowledge services. And we're hoping to offer more digitised services at the point of need for doctors, nurses and managers within the organisation. So just providing the data and information where they need it.
And those digital services on the back of the pandemic have come into their own there. And I know that the offer from the library team and particularly head librarian Samuel, very keen and passionate about making knowledge and information accessible. Got a number of really key resources that all members of staff can access. And you're right, if you need an article, they can generally find it for you. The last thing I want to sort of deal with, and it really isn't least, because these are a really important group of people in the trust, and it all comes back down to the patient, doesn't it? Because this is the simulation team, and we put together a simulation suite some years ago in the trust now, and they've just grown and developed, offering classroom-based, in situ opportunities to practice those really difficult scenarios, situations, critical illness. So teams can work together in that safe environment, putting in practice what they might need to do when they're in front of the real patient.
Yeah, that's right. I think the key word there is safe environment. It's a wonderfully supportive sort of training centre that we have in the organisation. We're very lucky that the trust and the board and the trust sort of took a leap of faith and helped us fund that and convert some space in the education centre, and also allowed us to go out and recruit a wonderful simulation manager in Bruce Kerr and an excellent simulation technician in Mary Holding. We've got a clinical director, Dr Ratnamaka, who also leads them and provides a strategic direction for our service. It's been a huge success. Actually, they've been a victim of their own success because it's very difficult to get additional training booked into the room because they are using it 5 days a week, and the outcomes are superb. The feedback in terms of confidence levels for people that undertake their training is something in the region of about 98% of people have said that their confidence has improved following the session. So, like you say, it's all about team working. It's all about communication skills and putting the patient at the centre of care. It's a wonderful service. I can't say enough good things about it, actually.
I think that's a really great way to finish. Thanks ever so much for coming to talk to us about the medical education, teaching, training, learning activities that you are involved with here at the Trust as we celebrate becoming a teaching hospital.